Hello friend, and thank you for joining me for this session on patient comfort. My name is Juan Acosta and I am a natural comfort specialist from hypnodontist.com. That's right, hypnodontist.com means that I'm a hypnotist by trade and I worked then as a dental office manager and patient coordinator, which is how I'm going to be able to bring you some very valuable tips. But let's not spend any time talking about me because I want to share with you some valuable tips and just spend your time building your practice. So the first thing to think about is why might you want comfort in your practice? And I want to give you a quick comparison. Which kind of patient do you want? The patient who is comfortable, who is relaxed, who is happy to be there and just enjoying their day and the dentistry is part of their day? Or is better to have a patient who is uncomfortable, anxious, maybe a little bit nervous, not really happy to be there, doesn't really like dentistry, right? Okay, so this is obviously a very easy choice, I think, for you if you're watching this video about comfort. However, believe it or not, I have ran into a very small number of practitioners that have been, I specifically recall a conversation where I asked that same question about, well, what kind of patient do you rather have? And the response from this particular doctor was, I don't care how comfortable they are, they're here to get a job done and I'm here to do their job. More like a mechanic working on a car. However, the big difference is that when a mechanic is working on a car, the car is external of the patient. Right? If something goes wrong with the car, I mean, it's a bummer, but it's not a huge deal. Whereas the mouth is internal in the patient and is very personal and is very invasive sometimes what we do, in dentistry as a whole. I'm not a dentist, I don't pretend to be, but I have been in many situations chairside, hundreds and hundreds of different surgeries and different styles of surgeries and with different doctors. And that has given me some broad idea of how things should work if you have the same goal that I have, which is to improve the perception of dentistry as a whole in the public. Because when that happens, when the perception is better, then dentistry as a whole wins, right? Like they say, a rising tide lifts all boats. So that's the kind of approach that I like to take. So let's assume that you're not that 1%, that one dentist that's like, no, I don't care how comfortable they are. I'm just here to do a job and they're here to get the job done. Let's assume that you're not that. And if you are that, please change. If you are not that, if you're that 99% of us who are like, no, we understand that comfort is important. I mean, when I go to the dentist, I want to be comfortable. I want to be catered to in a way. And that's what this video is about, because everybody's a little bit different in how they like to be communicated with and how they like to be handled in certain situations. So if you want that patient who is comfortable, who's relaxed, who's happy to be there and who's not going, oh my God, I hate the dentist, but rather, hey guys, I always like seeing you, and you can talk about family and friends and hobbies and other things, right? You're building that relationship. If you want that kind of patient, then it's important for you to spend the time early on to get to know that patient. And what I've noticed is that a lot of practices don't have a real process for getting to know their patient and understanding them at a deeper level a little quicker. And what happens is then you have the patient that comes for one treatment and they don't feel like you gelled right with them, and then they leave for the next part of their treatment plan. And I tell you, I've been one of those patients. I've jumped dentists because I didn't like the way they handle certain things. Currently, I'm with a dentist that I'm very happy with. I love their team. I love the way they handle things. I love the way the office looks and feels. This is something that we're going to talk about, of course, throughout this video. But what I want to give you in this, if you get nothing out of this video except this one thing, is that comfort is very important to every patient, and every patient perceives comfort a little bit different. So I have created a tool for you and for all the practices that I work with that will help you assess a little bit of that personality trait that a patient might bring that's unique to them, or it helps you assess what their past experiences have been like so you can deal with any issues up front, because that's the best way, right? If you are able to get to know your patient and they realize that you care, that's point number one. When they understand that you care, they think, oh my gosh, they really care about me. They know that you're not that one dentist that's like, no, they're just coming here to get a job done like a car. But you actually care for them as people, right? As humans, as people that feel, right? So what I'd like to do is share with you this simple tool that I've created for my client, and it's free for you to use. It's not branded, so you can actually print it as is and just start using with your patients. And what I want to do in the next few minutes, if you will join me, is I want to take you through the sections of this little information sheet, which I call the patient comfort intake, which simply asks about their experiences and their preferences with dentistry so that you can communicate with them thinking about the platinum rule, not to be confused with the golden rule, which we all know the golden rule, right? The platinum rule says we do unto others as they would like done unto them, which simply means that we don't just consider how we would like to be treated, but we consider what those people want and need, and we aim to deliver on that. So it's just a slightly different approach, but it's important because being patient-centered, just like in my profession as a hypnotherapist, being client-centered is very important. Is being very considerate of what the person in front of you actually needs and wants, and be able to deliver that. And I'm going to give you some examples throughout the sheet. So to get this patient comfort intake, you can download it for free at hypnodontist.com/comfort. COMFORT. hypnodontist.com/comfort. And you can pause the video for a minute and then come right back. Let's sort of dissect this patient comfort intake. It has 6 different areas where we are essentially eliciting information from our patients, so that when we know these, we are able to maneuver through conversations and lead them through a process that will feel more familiar with them. If you think about what you do in dentistry and the relationship you build with your patients, it's all about building trust, right? About gaining their trust so that you can actually stick your hands in their mouth and they'll be fine. They will still like you afterwards, right? It doesn't happen all the time. There's pain, there's issues with finances. There's a lot of different issues that make dentistry scary, or at least stressful for dental patients. So we want to just kind of get a feel for what their experience has been, and that's what this sheet is about. So the first portion of the first section, I'm going to talk about these sort of 6 different areas. First area is which feeling best describes you, and this is how they feel about dentistry as a whole. I'm comfortable, I'm fine, I'm anxious, fearful, or phobic. Comfortable and fine, of course, they're okay. You can probably not do much with them, just kind of treat them like they're normal people. However, if they're anxious, fearful, or phobic, those would be good distinctions for figuring out how to lead them through a process that will be more gentle for them. Because if you think about what will make a patient become that lifetime patient, right? I always talk about the drive-by patient that comes in for that one treatment and runs away, or the lifetime patient, right? That came for that one treatment and stayed with the practice because they treated them so well that they came for that next crown, and when the tooth broke and when the family needed treatment, right? That lifetime patient is what we're after. So if you know that a patient is anxious or fearful or phobic, then you are able to deal with them in a slightly different way. You know that maybe you need to schedule just 5 minutes extra so you can teach them one of these exercises that I will be teaching you in another video. So if they were phobic, for example, that would be something to where you say, okay, maybe let's not just have an appointment immediately to have dentistry done, but let's have one session with a local hypnotist, or with Juan, with me. You can refer a patient to me for a session to help them actually have dentistry done. There are a lot of ways in which you can deal with them. This is about eliciting that information so that you know how to start. So that's the first section. How do you feel about dentistry? What describes you and dentistry, your relationship. The second section, I kind of did it just so that it would fit the page. Next section is at the top, says my dental experience is growing up where? And the options are completely comfortable and pain-free, somewhat uncomfortable, painful, or traumatic. Of course, why would you want to know that? If you know that they've had a traumatic or very painful experience throughout their life, you can ask them about it a little bit and open up to conversation. When you say, for example, to a patient that checked on traumatic past experiences, you say, hey, I see on your sheet here that you had a traumatic past experiences with dentistry. Can we talk about those? And the patient might come up and say, oh yeah, they tied me down to extract a tooth when I was 6, or whatever. happens. You hear these horror stories of dentistry, and that's not what dentistry is like, not nowadays. But people sometimes don't know that, and a traumatic experience can stay with you for a long time, which is how hypnotists have a job, in part. So if you have been able to elicit this information, and you know that they've had a traumatic experience, and you can say, hey, let's talk about it, and they say, well, they tied me down, whatever, you can then use some simple, just getting to know people concepts, building rapport concepts that you probably already know. And if you don't know, I can help you as well. But you can say, oh, you know what, dentistry is not what it used to be. Yes, they used to do that in all times, but here, haha, we're very gentle. We would never do that to you. And reassurance is what that patient might need. If you think about the patient's subjective scale of discomfort from 0 to 10, which we all know, right? That patient that comes to your office and is very anxious says that they're a 10, or maybe they're breaking that scale. That patient could easily become a 9 or an 8 simply by you showing that you care. And you showing that you care could start by them filling out this sheet and you saying, hey, I see that you had a traumatic experience. What was that about? That simple showing that you care can lower them on that scale. Right now, if you want them to feel like a 7 or a 6 on that scale, then you could have a little bit more candid conversation about maybe some procedures that they're going to have, or you could answer some questions that they might have. You understand? Easy. If you want to bring that level to a 5 or a 4, you could spend 3 minutes just giving them a simple breathing exercise and showing them that you really do care. Just taking them into a little one step further into your relationship with the patient, because understand that if you want that lifetime patient, how long is your relationship going to be? Years, right? Ideally, they're going to stay with you for a very long time. So you're here making friends at the same time as you are, of course, offering the standard of care that you are there to offer. So knowing what their past experiences are like is going to be very important. Let's move to the next point. I can get wordy sometimes. The next point, it says, when it comes to my oral health needs and procedures, I prefer. So this is about their preferences and their personality, like how much stamina they have as a patient and what their preferences are. The options are detailed explanations in clinical terms, general descriptions in simple terms. So that's basically A and B choice. Why is that important to know? Remember the last time somebody tried to explain something to you and you had it with this much idea, you're like, oh yeah, I got it, I understand. And the person kept going with boom, 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 this much detail. And you're like, whoa, that's too much, right? Something explained to you in too much detail can be frustrating and can be overwhelming sometimes. And conversely, sometimes you need that much detail and somebody goes, oh, well, you just do this and that. And they gloss over all the details and they just give you that little piece and you're like, whoa, I was needing all that detail, right? There is that difference. And if you have a mismatch in that, then neither one of the people feel like the other person understood, right? Like the person that gave all the detail and noticed that the person was already overwhelmed was like, well, that went over their head, right? It's a mismatch in any direction that you look at it. So ideally, the answer to this question is going to help you decide how to communicate with those patients. The next couple of parts on that same section, because this is all about their preferences, is do I prefer more work done in less visits or limited work done in more visits? Of course, this is all about their stamina, how much they want to get work done, right? If SRP's in 1 quadrant or 4. Right? How do they prefer to do things at the dentist? Some patients are very nervous and they don't want to go to the dentist 3 times. They rather go once, longer time. So it's a personal decision. But if you know that ahead of time, then when you're scheduling them, you can say, hey, I know that you'd like to get a little bit more work done in less visits. So let's look at your treatment plan in this way. And that helps you connect with the patient because they're like, wow, they really care. They really understand what I'm like. So this sheet, don't underestimate it. There's a lot of power in finding a little bit of information that's important and being able to deal with it in a proper way. The next section is which of these applies to you if any. And this is about specific concerns, which is important. Each of those concerns, or each of these tick marks, I guess, has their own meaning and can give you important information. So let me just read them to you. Of course, hopefully you downloaded the page and you have it, but let's talk about them. I have concerns about possible discomfort. What does that tell you? That's somebody that's anxious a little bit about the future, something that might happen, but maybe you're doing something that's not that uncomfortable. Maybe you're doing something that they haven't had done in years and equipment has changed. So you will have ways to maneuver that conversation. The sound of the dental drill bothers me. Of course, we know we have to speak in their terms. We know it's a handpiece. They think of it as a drill. Looks like a drill, sounds like a drill, vibrates like a drill. Must be a drill, right? So deal with each of these issues as they arise. Needles make me uncomfortable. Dental instruments make me nervous. I don't like feeling numb afterwards. I'm concerned about my tooth sensitivity. I don't normally have concerns at the dentist. I have a sensitive gag reflex. I have lots of questions. A person that says, I have lots of questions, you know, you have to maybe save a little bit of extra time and say, hey, by the way, I noticed that you like to ask some questions in general about procedures that you have done. Do you have any specific ones for me right now? You know, make sure that you open up that conversation so that they feel free to act upon what they said, that they like to ask lots of questions. If they have a sensitive gag reflex, you can say, hey, by the way, here's your pen, your gag pen. And you give them a pen to hold in their hand and say, as long as you focus on holding that pen hard in your hand and you breathe through your nose, you can't gag. And that will take their attention away from the mouth and get them to breathe right and get you to have the ability to give them proper treatment without having to spend so much time digging in and noticing that they have gag reflex. You're saying, hey, by the way, notice that you have that. It says here that you have a sensitive gag reflex. Maybe it's because you haven't used that gag pen, and then give them the pen. Yeah, there are lots of little tips like this that I can give you throughout the entire process. When you take a patient from the moment they call you the first time to when they have had treatment and left you video testimonials and they've brought their families and friends. So there are lots of tips throughout the process, like the gag pen, for example, is a very simple one. This sheet gives you that information. You can copy it or you can print it as is and just use it again. It's unbranded, it's ready to use. Next section here is my immediate concerns about my oral health and teeth and smile are, and this is just a place for them to write a few lines of subjective self-evaluation. You know, because somebody might be just fine with the smile they have and they might just want help with that one thing. So if you look at their concerns right here and you're able to present in that way, you know, even if they say, all I want is to check this one tooth that hurts, you can say, hey, I notice here that it says that you rather just check that one thing. However, it is our standard of care that I have to explain to you a few more things about your mouth. There's no obligation, I just have to explain some things to you, and then you can actually present a treatment plan and the person can't quite be mad at you. If you have listened to them, you understand their concerns, and you have communicated with them in a way that says you care, right? That you have paid attention to what the person wants and needs, and you have made an effort to deliver that way. That is important. So their subjective self-evaluation will help you decide how to approach. And then the next and last section here, the sixth section on this patient comfort intake, is basically for spa style of amenities. We used to do this at some of the practices that I've worked with. I haven't been working inside a practice for a while, so that's why I say we used to do this. Offer them a neck pillow, offer them a little blanket, offer them a pillow for under their knees, offer headphones. And this is just an added benefit that doesn't cost your office too much. It's actually fairly easy to get, and it does make the office feel more like a spa. And this is important because a lot of times when I would approach them after the service was done, my job was to approach the patient and say, hey, Mary, how was your experience? And she would go, oh my gosh, it was so good. It was more like a spa than a dentist. Then my job was to get a testimonial from Mary and post it online and do all these things to promote the practice and help a patient who was happy bring more patients who would be happy. So this is what prompted that kind of response. And if you don't have these issues, these things, these amenities, then you may not have the same response as, oh my gosh, you were more like a spa than a dentist, right? Because obviously these are sort of spa-related services. The services are headphones, neck pillow, knee pillow, eye mask, or blanket. And it says, please circle below any complimentary amenities you'd like to enjoy during your visits. So you can download this page and use it as is. It has been written with hypnotic language in mind to allow the patients to open up, to really think about how they feel about dentistry, and hopefully give you really good information that you can base your relationship building upon. Okay, so when you download this at hypnodontist.com/comfort, you will also, this is actually just part of a package, the Patient Experience Blueprint package, which is a full presentation that I have that includes, this one little part that I'm giving you right now. But let me just tell you what else is on that download, because there are usable things that you can certainly start working with right now. And you can also join me for some other videos where, for example, there's a techniques outlines, 2 specific techniques that I've used with countless dental patients because they're really useful at helping a patient change their state. Somebody that comes in and says, I'm freaked out of needles, I can't be here. And you can say, hey, listen, can I show you something? Can we spend 5 minutes with a little exercise? Because those 5 minutes are going to save you a lot of time in the chair. They're going to save you a lot of headache, because that patient now is going to be like, wow, these guys are on it. They're not like any other dentist, because now you know this little 5-minute exercise. Okay, so in the downloads, you'll find technique outlines. That's 2 different techniques, which I will teach you in other videos, because this video is just about this one page. But you do have the technique outlines, so you can definitely read through those and see what's, if you can figure them out, or you can probably find them online. I'm sure you can. There's also a patient experience blueprint handout, which is what I take my presentation through, and it has some blocks basically of information of where we'd be filling out if we ever met in person for one of these actual presentations or online. And there's also a DPO assessment, a dental practice optimizer assessment, which is the sheet that I use to evaluate practices that are wanting to work with me, to sort of assess where they are right now, so we know what that next level is, where I can take them. Okay, so if you'd like to participate, you can assess yourself. Of course, just fill out the form and see where where you rank, or how you think that you can deliver better on your patient experience. And if you want me to give you some tips on how maybe you can improve from that, or if you want to connect so that we can actually work together and I can help your team kind of make those simple changes that will take that patient experience to the next level, then there is instruction on that same DPO form on how to send it to me. You basically just take a picture with your phone and send it to me. You can send it to me by text or email. Instructions are right there. So let's see, is there anything else on that? There's also a referral form on that download for the patient intake, patient comfort intake. There's also a referral form for hypnotherapy services. So if you have a patient who is grinding their teeth, for example, and you have given them a bite guard, and you're working on maybe them not breaking that 3rd crown that you have made for them, and you've given them a bite guard, you've done your service, we can work as an adjunct. And when I say we, I'm talking about hypnotherapists. We can work with you as an adjunct service to help the patient relieve, and their clients to me as a hypnotist, their patients to you. I refer to them as patients in your practice. I can help your patients reduce their grinding basically by working with the underlying issue rather than just the symptom, right? The symptom is they're grinding, they're clenching, they're breaking teeth. The underlying issue is that they have internal conflicts, they have stress, they have things in their life that are not going quite right, and they are grappling with things. And I can help them through a 4-session protocol, or one of my colleagues can help through that same 4-session protocol generally, and that would help them relieve that underlying issue. So any hypnotherapeutic services like that, or a patient who is smoking, and of course you as a dental professional, you want them to stop smoking and other negative habits, nail biting, tobacco chewing, all those negative habits where it's mind over matter and it's hard for them to get through. So that's what the referral form is. If you have any patients who'd like to come to a hypnotist or myself, please check it out. And of course, if you'd like any help with the implementation of what we're talking about here or any of the skills that I teach, I would love for us to connect. If you have any specific issues that you'd like to bring up for discussion and maybe see if I can give you some simple tips, it's most likely that I can. I have encountered a lot of different issues and I've worked in a lot of different areas of the dental practice. So please consider me a resource and just reach out. You can find me at hypnodontist.com, and you can also send me an email directly at juan@hypnodontist.com. Easy. So I happen to believe that the patient experience is everything. If a patient is happy with you, they are going to bring their friends, they're going to bring their family. If a patient is not very happy or ambivalent to you and your services, they're just not going to help you build your practice. So that is sort of the one final thought that I want to leave you with today, that there's a revolving door of patients that come through your practice, a bunch of different kinds of people that come through your practice. But there's only one of those people, one of those types of patients who actually helps you build your practice organically and sustainably. That they refer their friends, that they refer their family, and they come back to you. Even if they have moved a few miles or a few hundred miles in some cases, they will come back to you because you have built that relationship. And that is a very happy patient. Okay, so final thought. The happy patient is what you're after, that lifetime patient. And it all starts and ends with patient comfort. Thanks for joining me again for this video. I hope you enjoyed it, and I'll see you next time. Bye for now.